Hi, everyone. Welcome to the Superfeeler podcast. My name is Lori, and I am very excited today to be joined by Glauco Valdivieso, who is a psychiatrist from Lima, Peru, and is the Latin American rep on the International Society of the Study of Personality Disorders board. So we met in Boston at the ISSPD Congress in 2025. And what I love about his work is that he doesn't, so much of his work on social media, you have quite a decent following over there, and it's all in Spanish, or most of it's in Spanish. So I don't even know what you're saying, but I still follow you because I love hearing so much information being shared in a language that's not English, because I feel like so much of this work is done primarily in English. So with that, just obviously noting that this is your second language, and this is, maybe slightly nerve-wracking. I wish that I spoke enough Spanish to be able to speak to you, but we'll take it slow and you're going to do great.
Hey,
awesome.
Thank you.
I believe in you.
So cool.
Yeah. So thanks so much for being here. Could you tell us a little bit about yourself and how you got into psychiatry and an interest in personality disorders?
Yeah. First of all, it was so nice to meet you in person last year.
Mm-hmm.
And thanks for the opportunity to talk about, my passion is talking about personality disorders. That is how I'm going to introduce myself. I'm a psychiatrist. I live and work in Lima, Peru. I work in the public service in a public hospital. It's like a general hospital with a mental health unit. I am the chief of the mental health unit at the hospital. Also, I work in a private practice, especially in the area of personality disorders, and also I am specialized in mood disorders. So this is a comorbidity that is very associated with personality disorders, and I see a lot of cases in my private practice. Also, I work as a professor in a new university. Is the Universidad Científica del Sur, Scientific University of South, here in Peru.
Okay.
Also, I'm a researcher. Especially in topics related to general psychiatry and personality disorders. So this is a brief summary of my career and what I do in Peru.
That's amazing. And yeah, you do so much varied work, which I think is so cool. So what does being a psychiatrist look like in Peru? I'm in Canada, so our system is so different than the United States, which we all hear about. What is it like in Peru?
Well, being a psychiatrist, it's like you can pass 3 years doing a special training in a residence program. There are a lot of places or hospitals you can make this training. And then you can work in a hospital. There are 3 main psychiatric hospitals here in Lima. Also, you can work in a general hospital, and this is my case. I work in a hospital where there is a mental health unit, and also work with other specialties in the area of hospitalization, emergency unit, and outpatient service. Yeah, it's like attending patients face to face. Yeah. This is a general hospital. Also, you can work in a private practice. That is also my case, attending patients with no insurance. And it's like working freely, promoting your services and that kind of things. And you can work with other professionals. For example, I am a co-founder and a medical director in a place that is called IPEP. That is an Institute of Personality Disorders study here in Lima, where I work with psychologists and other professionals like social workers and that kind of things that is so necessary in the work with patients with personality disorders. So and also you can work as a professor in university or an institute. That the work of a psychiatrist or a physician is to attend patients in any institution, and you can also teach for medical students or physicians in training for a residency program. This is it's a view that is for general. No, this is for a physician or a psychiatrist here in my country.
That's awesome. I'm so glad there's kind people like you working as psychiatrists there. So is a lot of the work you do medication focused then, or is it psychotherapy as well?
Well, I think both.
Okay.
Especially in my area, this is why I see my specialty in personality disorders so important, because when I got into this area, I saw that I had to adopt an integrated view of how to treat patients. And well, in a general training for a psychiatrist, most of the professors tell us that the focus on a biological treatment, but in the past of the years, you can, and experience let you know that it shows you that no, this is not the only way. The best way to treat patients is integrating psychotherapy and biological treatments like psychopharmacology, and this is how is the best treatment in personality disorders. Yeah, and I had to know this along the path of the years. I'm a passionate professional in psychotherapy. I'm a therapist certified in transfer focused psychotherapy, for example, and also in DBT,
Cool.
that is the dialectical behavior therapy. So
Awesome.
I had to see my profession in the most integrated way.
Yeah, totally. For me, that's the combination of medication and dialectic behavior therapy has been life-changing, and I don't think I could do one without the other. So I was looking into some of your work, and you've done some cool work around BPD in the elderly. Could you tell us a little bit about what you found specific to that population?
Yeah, well, a few years ago, I had the opportunity to make a review of this topic, and I was interested in looking for evidence of BPD in elderly because of the experience I've had some patients that they were 60 or 70 years old. Then they told me that they had like an inner sense that of uncontrolled feelings, and it's like I can't remember the word, but it's like an empty,
like emotion dysregulation.
an empty feeling,
okay.
feeling of emptiness, chronic emptiness, and they felt that they didn't get objectives through their lives. So that was something interesting for me, because knowing more about their life, their personal history, there were a lot of things related when they were in the 20s about suicidal attempts or suicidal behavior in general. And so what I found in this review is that people in the elderly, they can get better. They can get better with the suicidal attempts and suicidal behaviors in general, but their emptiness, their feeling of emptiness, and the sense that they couldn't reach something important in their lives is present in the most part of their lives. And this is associated with depression, associated with anxiety disorders, and stressful events, and this kind of mental health problems that is chronicle, that is chronicle in when they tell us how they spend their lives till the elderly.
Interesting. Yeah, that feeling of emptiness piece, I feel like isn't super researched because it's hard to understand and describe and like operationalize, I guess. Yeah, I mean, I think about my dad, who definitely would be diagnosed with borderline personality disorder if he had sought treatment when he was younger, but he's 60 something now. And my understanding from other research, like Zanarini's research, is that the life, like over the lifespan, a lot of that symptomology kind of just goes away naturally. Partially, I think, due to learning how to just manage through life better. When you were looking at that feelings of emptiness, is there any sort of way that you can build that in people that are in their 60s or 70s?
The emptiness feeling is present in the most part of the life because the core symptom of personality disorders is don't know if it's right to say, but it's like an alteration in identity.
Mm-hmm.
Yeah, it's alteration in identity that is the core symptom of personality disorder. So it's reflected. Yeah, it's reflected in this emptiness, this chronic emptiness feeling. So this is because this is the core symptom. This is stable along the life. Yeah, but studies like Sanarini's, for example, says that people with no treatment can't get better. Can get better with their symptoms and primary symptoms of BPD. Younger are most related with suicidal behavior, and older people are more related with identity alterations. Yeah, but with treatment, these dimensions could get better even in the first years of these interventions.
Fascinating. And how does age impact how we should be treating personality disorders or borderline specifically?
The age of people with BPD or
Yeah.
Okay.
How does that change how we treat people?
Well, I think that is different treating an adolescent or treating because adolescents are more have different experiences, experiences like older people, and they are in a transition of having first experiences and bad experiences and falling in love and then feel bad because losing it. They are more impulsive in their behaviors, and then older people have other experiences like being worried about not losing their jobs or establishing more or better relationships. And older people are worried about trying to establish I don't know the word, but it's like
retirement plans and things, or
the retirement or about the problems of their family that kind of thing. So and also the way to treat a patient is different for each period of time, for each term of life. So we need to have a specific stance, for example, being trustable or empathic and applying a lot of validation, especially in younger people with BPD.
Yeah, especially because a lot of the time systems have, at least in Canada, and the States, people have been invalidated by medical professionals for so long. So having somebody validate them that is in that position of power is important.
Yeah, and treatments like DBT, that is a dialectical behavior therapy, was created because of the invalidations and the contextual problems that is so important in BPD because of the problems in early life of people. Even in the 80s or the 90s, the therapist that was dedicated to personality disorder didn't know or didn't have this intention to apply validations for these patients, because in their counter transference they were so tired and burnt out with this behavior. So DBT came to change the way to see patients, and this is the treatment that is most studied, has the evidence, the best evidence in treating BPD.
Yeah, it's such a good treatment. So a lot of the work you do on the international front with the Society of Study of Personality Disorders is about bringing Latin American voices to the table on the international side. So what kind of exciting work is going on in Latin America in the personality disorder space that you want to share with us today?
Yeah, well, I'm part of the board of the ISSPD board, and also I am the vice president of the Latin American region of the ISSPD. Since the beginning of the last year, I try to join with other professionals that they are friends and professionals well dedicated to this area. They are from Chile, from Costa Rica, Puerto Rico, Mexico, and Venezuela. Myself from Peru. We've been organizing some conferences free for people for the community, because we know that is so important for the association and for the community to know more about the personality disorders, especially for BPD. People nowadays don't know as much of how or what is BPD.
Mm-hmm.
And there is a lot of stigma. There is a lot of stigma, and people don't understand about this topic of these terms. So
yeah,
our work is to make conferences and try to reach more people through the social media.
Yeah.
To speak in an easy way about what is BPD, how is its etiology, how is their clinical features, which are their main treatments. So this is a way to get close to people in an easy way and free for everyone. So this year we are having two conferences, no, there are two presentations or conferences, webinars for people. We don't have any schedule in a scheduled date, but we are going to publish this on our social media, that we have an Instagram account.
Yeah, I'll link that in the show notes too.
Yeah, this is an opportunity to tell people that they can check the Instagram page, and we are working in our first congress, maybe maybe any of the country of people who are in the board. I think that is going to be in Chile, but we are organizing this. But we are so excited to have our first meeting in one of these country for professionals who wants to join and know more about our work.
That's fantastic, because there is obviously differences between, even between Canada and the States, and then let alone other countries, of just the reality of what it's like to live with personality disorders and to treat them. So is there anything that you really notice around cultural context of how BPD is diagnosed and treated in either Peru or Latin America generally?
Well, I think that every country have the same information and updated and the updated information of how to treat a personality disorder. But in Latin American countries, we are just including some of these trainings, especially in psychodynamic treatments. Here in Latin America, we know a lot of dialectical behavior therapy, because there are almost 10 years since the model came here to Latin America, and in Peru, there is a lot of time too. But in psychodynamic treatments, for example, transfer and focus psychotherapy or mentalizations-based treatment, that is used a lot in other countries. Here in Peru, here in Latin America, don't know as much of this, because there is also an stigma in professionals, because they think that psychodynamic treatments, it's like the classical psychoanalysis. So
right, Freudian stuff.
It's so but it's so different, and it really helps people if we check the protocols or guidelines and the studies that shows that how important these treatments are. So also the way to treat in biological treatments, for example, in pharmacological treatments, we use a lot of this, but and I think that in other countries it is the same thing. But the tendency is that the integrated way to treat is the best, and it really helps patients who don't want to be that their problems become medicalized.
Yeah, it's just treated in the medical sense as opposed to the psychological and emotional sense as well, right?
Yeah.
So you talked about stigma from professionals around psychodynamic treatments. What's the stigma like against personality disorders from providers and the public in Peru?
Generally, people think that a person with BPD is like a problematic. It's problematic. It's people that they are not reasonable, that they are impulsive, aggressive.
Mm-hmm.
And this is how people understand the BPD, and it makes that people refuse the help for these people, and they are not considered for jobs or for being integrated in social events, or maybe for studies, and that kind of this kind of areas that people with PPT could have this functionality. Could have this functionality, but this is not part of their decision. This is part of their condition that could get better with an integral treatment, an integrative treatment. But we, as a professionals and like as a society, we need to know how is the context behind the behavior of people with BPD, because we don't know. They came from a lot of stigma, misunderstandings. They come from a lot of violence because of an invalidation in their homes and through their life. So we need to know more about this. We need to mentalize their behaviors and their emotions. This is a therapeutic stance that we need to integrate in our common practice as a mental health professionals.
Agreed, wholeheartedly. It does sound like the stigma might be slightly worse, maybe because DBT only got to Peru 10 years ago or something like that. So there's a little bit less opportunity for people to have been treated. But yeah, again, providers like you are so important because you're the ones fighting for us within the system. So for those who are listening who are in Latin America, do you have any tips on how to access care well, or any resources they might not know about in Peru or elsewhere?
I think that for professionals, for clinicians, I recommend to integrate or include in their training, specializing in psychotherapy in general. I'm a certified psychotherapist, but in psychodynamic treatments like TFP and DBT also. But I think that every model of psychotherapy is so important, because this helps us to know more about our patients, to treat better, and to know more about their lives in a human way. It's like a human, not like a group of symptoms.
Yes, but, totally. We're all individual people.
A human being,
yeah.
But a human being, knowing more about psychotherapy helps us a lot as professionals and as a person. And people who wants to get a treatment, first of all, you need to go to a professionals who has a stance in how to treat, like integrated way, gives psychoeducation. Nowadays, in the public service, for example, in a general hospital or in a community mental health centers, it's there are a lot of opportunities to get an specialized treatment like DBT, for example. So things are changing in our country. So there is hope in getting better for this condition, BPD condition.
And what do you like most about working with people who have borderline personality disorder?
In a personal way, there is a challenge. There is a challenge.
Mm-hmm.
And the thing that I love the most is when you know more about these people who could be aggressive or could be impulsive, and they always try to kill themselves. You know more about how they are as human beings, and you know more about their context, you know more about their lives. So you know how you can do things better for them.
Yeah.
And this helps to you like a person also, because you open your mind to know more about them. You know more about their lives, and you apply also this for your personal life and people around you love the most. So this is I think these experiences that I had treating with people with BPD was like a gift and helped me to be a better person.
Mm-hmm.
Yeah, I think this is the thing that I love in this work, and I love being better for them to change their lives.
Beautifully said. Well, Glauco, thank you so much for coming on the show. It's been so great to hear from you and get a chance to talk about your work. And I will link all of your social media in the chat or in the show notes, because I think it's really important that people follow you and then they can hear more about the awesome work that you're doing. Awesome.
Thank you for the opportunity.
Of course, anytime. Thank you so much for listening to the Superfeeler podcast. This episode was recorded on the traditional and unceded territory of the Matsqui and Sumas First Nations. If you'd like to learn more about the Superfeeler podcast, share your story, or participate in the Superfeelers Club, which is our peer support group, it's totally free, virtual, and open to anyone who experiences intense emotions or has borderline personality disorder, please check out the link in our show notes or go to laurieedmondson.com. If you would like to support the show, we would very much appreciate it. There's an option to do monthly small donations at whatever denomination you'd like, patreon.com/superfeeler, or again in the notes below. Thanks again and have a great day.